Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Welcome to another episode of the Wow MD podcast, Wellness Optimizing Warrior, fighting for you. Today, I want to wow you with my perspective and very simple way of looking at how the body works and why NAD might be the miracle molecule. Don't worry, we're not going to go back to chemistry class, and I'm not going to go over some basic biology facts and create a biology lesson out of it. I'm going to make it somewhat fun, but pretty heavy, but I'm going to try to keep it simple so you can look at the big picture and understand NAD. You might have already heard of NAD. You might have done an NAD IV infusion, and it made you feel either awesome in a day or two, or it made you feel terrible for 1 or 2 days. So it's hard to say whether it did anything or not, because you had such a bad experience with the infusion, or you had something going on at the time which you were hoping that you were going to get improvement from, and you did feel slightly better over time, but you didn't know what's to be attributed to and what helped or not. Maybe you're taking NAD orally or a supplement that increases NAD, and you've heard that it does something great for the body, but you're not sure why. Well, regardless of what the situation may be, maybe you have never heard of NAD. If you listen to today's episode, all your questions will be answered. You're going to be an NAD expert. You will teach other people. You will spread the knowledge. Maybe down the road, save someone's health. The human body is a very extremely complicated, sophisticated biological computer, especially if you look at it from this perspective and you're going to zoom in what really matters beneath the skin, inside the body, at a molecular level. Why is it important to understand this? Because I'd like to give you some facts and numbers, and I'm just going to rattle them up really quickly so you can kind of get a little perspective into what's what. So just to give you an idea of the human body and its complexity, we have about 78 organs that keep us alive, okay? Out of these organs, the human brain has about 86 billion nerve cells. We produce with all these organs about 50 different hormones. There are about 75,000 enzymes in the human body, crucial for different processes, digestion being one of them. The body produces about 7,000 known peptides, and there are probably over 300,000 peptides in our body, all of which perform very important functions. Coming back to the organs, maybe you didn't know that the heart contains an estimated 2 to 3 billion cardiac muscle cells. The human liver contains about 2.5 billion cells. And then the kidneys, each human kidney has about 1 million tiny filtering units called nephrons. The human body has about 300 million skin cells, and a square inch of skin contains about 19 million skin cells. And they're constantly being replaced. Apparently, an average person, you can find this on Google, sheds about 600,000 cells per day from their skin. We have about 13 essential vitamins. We have about 20,000 to 100,000 number of proteins in the human body. And the human body experiences trillions upon trillions of chemical reactions every day. On an average, it is estimated that around 100,000 chemical reactions occur in the human body every second, okay? So now that I threw these numbers at you, let's see why are we talking about understanding the body at the molecular levels. Because many of the things that cause disease and dysfunction are a variety of things that literally take down our mitochondria, your mitochondria, and its ability to generate the energetic needs of the various cells leading to disease, dysfunction, and possible cancer and death. And I'm talking about toxins, infections, microorganisms like bacteria, viruses, molds. I'm talking about nutrient and vitamin deprivation coming from a diet of processed foods. And remember, restaurant food is processed food. If you think I'm crazy and you say, well, I know I can go to the restaurant and I can eat fresh food. Well, unless you have a farm-to-table salad, none of your food cooked in a restaurant is fresh. Go back and listen to the episode where I talked about our diet. You'll find my very simple arguments about restaurant food. Don't want to rehash this here. Now, what if we could simply replenish and restore a universal essential molecule to optimal levels? What would that look like? What would it do to our body? Well, this is what NAD is. NAD stands for nicotinamide, adenine, dinucleotide. And why am I talking about it today? Is because we cannot live without NAD. Our bodies require NAD to live optimally. And we know that remarkably, aging is accompanied by a gradual and steady decline in cellular NAD levels in all tissues. This decline in NAD levels is presumably linked to numerous aging-associated diseases, including cognitive decline, cancer, metabolic disease, sarcopenia, which is loss of muscle mass, and frailty. Many of these aging-associated diseases can be slowed down and even reversed simply by restoring NAD levels. So if we can target NAD metabolism and be able to naturally or artificially improve NAD levels and restore them back to younger, healthier levels, then we could possibly extend the human lifespan, but also our health and well-being, right? Well, many people swear by NAD, both patients and medical providers. So there must be some truth to it. Why is it so expensive? Well, it's difficult to make. It's difficult to have it sterile for an IV infusion. The IV infusion would take hours to infuse properly at the right rhythm and the right dose. So there's the cost of medication and the cost of administration. Then let's talk about oral transdermal supplements, which is going to come in a little bit. The raw materials, the bioavailability of these materials, all of this dictate the cost. Now, here's the problem. We, as well as you, all of us, can be very easily the prey of marketing. If you go to whatever supplement company makes NAD, you read their website page, they will have multiple arguments justifying why their product is the best on the market in this multi-billion-dollar supplement market. NAD's got a lot of potential. However, there are so many variables that ultimately impact whether or not the NAD is going to work for you. You might spend close to $100 or more a month, which means over $1,000 to $2,000 a year on a product that you buy as a supplement that might do nothing for you and will give you zero benefit. So this episode wants to address more information and give you information and wow you with these facts about NAD. So what do most medical providers recommend NAD for? What is NAD known for? Well, number one, it's highly used and very successfully so for substance abuse and addiction recovery. Apparently, NAD treatment helps manage substance abuse and addiction recovery by reducing cravings, by minimizing withdrawal symptoms and enhancing detoxification. It also likely restores neurotransmitter balance, optimizing brain function, reducing drastically the relapse risk. Number two, neurodegenerative disease and cognitive decline. It is really well known for this. Neurodegenerative diseases like Alzheimer's and Parkinson's lead to memory loss and problems with the way the brain and the nervous system work. NAD treatment helps repair the nervous cells, lowers inflammation, improving the health of our neuron function. This will slow down the progression of disease and might make it a lot easier to think. Number three, chronic fatigue and mitochondrial dysfunction. And this is a thing that is very common and widespread now. Chronic fatigue syndrome and mitochondrial dysfunction, they're intimately linked and they drastically impact quality of life. NAD treatment speeds up our metabolism, improving the way our mitochondria works. This gives people with these conditions more energy and less tiredness because it literally goes down to the molecular level, improving mitochondrial energy production and cellular function. Number four, age-related eye conditions. Age-related macular degeneration and other ocular conditions impact vision and daily activities. Treatment with NAD can help keep the eyes healthy by protecting retinal cells, by lowering oxidative stress and improving the function of mitochondria in our eyes. Individuals can explore NAD therapy as an adjunctive treatment option to surgery or other things that are happening that they need treatment for with their vision. Number 5, it can improve cardiovascular health, can address various conditions like obesity, hypertension, and various heart conditions like hypertrophy and cardiomyopathies. The cardiovascular system is particularly vulnerable to NAD metabolism dysregulation because there's a super high energy demand in the heart. And because the heart, the strongest muscle in our body, is not able to produce NAD de novo from scratch, can only do so from precursors. Number 6, improved immunity. It comes in extremely handy when you're dealing with an autoimmune illness and inflammation that consumes and depletes your NAD stores. As well, it comes in handy when you're fighting off a serious illness like COVID in an older person. I remember my mom got COVID in 2021, December 2021, and I personally, unfortunately, gave it to her and my husband. I was the least sick. I was the one who got it first. I likely passed it to my husband, who had it for a week. He required the monoclonal antibody treatment in the ER, but my mother was sick for 1 month or more. Did not get better until we did the IV NAD and IV vitamin therapy. She literally lost her appetite, had zero energy, could barely get out of bed, and she got a lot better after these infusions. Number 7, aging-related decline could be drastically improved with NAD, especially when the person is suffering cognitive decline, depression, anxiety, and fatigue. Number 8, this is last but not least, NAD could possibly improve sarcopenia, especially age or illness-related sarcopenia, which means massive loss of muscle mass. Research suggests that boosting NAD levels through supplementation may help substantially improve or even reverse the sarcopenia condition. Well, this sounds like the one essential molecule we should talk about and we should know more about, right? As I promised, I want to keep wowing you, my faithful listener, with facts and information you might have heard from other people, might have read in an article, might have heard about it on a TV show or a social media podcast, but you have not read or heard enough to understand the why, the what, and the how. So here I am attempting to make it easy for you. So I gave you all these numbers at the beginning of the episode. You know we have many organs in our body. All these organs have essential, crucial roles to play to keep you healthy. All your organs are composed of a very intricate array and structure of cells with unique characteristics and functions. So today, I am zooming in from the macrocosmos of your human body to the microcosm of the cells. Every cell in your body has a membrane to allow it to be a separate and unique entity, a cytoplasm, that is the gel-like substance within the cell, where most of the cell's chemical reactions will take place. And third and very important component, each cell has a nucleus containing the cell's DNA, responsible for controlling the brain activities such as growth and metabolism, so let's call it the cell's brain. Now, you learned all of this sometime in the past, maybe in high school during biology classes. Obviously, it has nothing to do with you becoming an accomplished, successful adult, so why would you remember? Well, whatever happens in the microcosm of your cells is essential to your health. And your health is essential to your success and accomplishment as a younger or older adult. So this trip down memory lane, biology memory lane, is necessary so you can have the key to maintaining the body in a healthy state at all times. So you're able to slow down aging or reverse and resolve inflammation and disease depending on your unique situation. I am going somewhere with this. I want to come back to the cytoplasm, the cell's interior and the main body of the cell. Within this cell's interior called cytoplasm, there are complicated arrangements of fine fibers, as well as hundreds or maybe thousands of tiny, unique structures known as organelles. Again, you learned about all of this in biology. An organelle is a subcellular structure that has one or more specific jobs to perform in the cell, very much like an organ does in the body. The most well-known organelle is the mitochondria, the powerhouse of the cell. It is responsible for generating energy, and last but not least, you might have heard of ATP. Well, in case you didn't, ATP is the energetic currency of the cells. To simplify and clarify things for you, let me put this out there. The body generates energy by converting the chemical energy stored in your food into a usable form of energy at the cellular level through a process called cellular respiration. That is how ATP comes to be. When you eat, your body breaks down your food, carbohydrates, fats, and proteins, into smaller molecules like glucose from carbohydrates, fatty acids and glycerol from fats, and amino acids from proteins. These smaller molecules are then absorbed into your bloodstream and transported to the cells. Inside the cells, especially within the mitochondria, these food molecules undergo a series of chemical reactions to release energy through the process of cellular respiration. The primary goal of cellular respiration is to produce ATP. ATP is used to power various cellular processes, muscle contraction, nerve impulses, building new molecules. Pretty much everything in the body runs on ATP. Without ATP, cells would be unable to perform most of their essential functions, which would lead to cell death, ultimately the death of the organ and the death of the body. So our bodies work with ATP. Just like the currency of our economy and financial day-to-day transactions is money, so ATP is essential for every cellular process and enzymatic reaction that happens in our body. So how are NAD and ATP linked? Why am I, the crazy lady, talking about ATP and cells out of the blue all of a sudden? Well, NAD plays a vital and crucial role in electron transport. NAD accepts electrons during cellular respiration, and these electrons are ultimately used to power the formulation of ATP, the, again, primary energetic currency of every cell in our body. So NAD acts as an electron carrier, and without NAD, we cannot have and we cannot make ATP. And without ATP, there's no energy available for the cell to do its job, and it will die. So let me put it in a bigger perspective. First of all, I threw all those numbers at the beginning of the podcast about the cells and the organs. But do you know how many cells the adult human body has? About 30 to 40 trillion cells. A little on the lower end for women, like 30 trillion. A little higher end for men, 40 trillion. They're bigger, bulkier. Our body is capable of regenerating, and the human body is constantly making new cells. It is amazing how we have cells that live only a few days to some that last us a lifetime. The process of cellular repair and regeneration, the making of new cells, cannot happen without NAD. So we need NAD to make ATP, and we need ATP to make just about anything. So how do we make NAD then? Let's talk about that for a few minutes. I'm going to try and not get too technical. Again, I'm not a biologist, but I do remember studying biology from my USMLE boards in the early 2000s. I got to tell you, I was fascinated by how amazing our cells are. And what is more fascinating is learning and understanding the processes involved in something as simple and essential as the cellular respiration. And it is sad that we learn all these truths about our cells, but we, the doctors, essentially graduate medical school and residency equipped with zero understanding on how we could take the essential truths of our cellular function and cellular energy chains and apply it into our practice. I just thought I should throw this out there as a thought-provoking morsel for you. But coming back to NAD and how we make it, a few words about the process of NAD formation. We make NAD through 3 pathways. From scratch, this is called the de novo pathway. It starts with tryptophan. Yes, you're right. Turkey has a lot of tryptophan. Number 2, it's called the Price-Handler pathway. Probably the guy who discovered it and described it. It begins with nicotinic acid. This is a B3 vitamin, also known as niacin. And number 3, the salvage pathway of NAD formation, which uses naturally occurring compounds also related to the vitamin B3. These compounds include nicotinamide, nicotinic acid, nicotinamide mononucleotide, NMN, and nicotinamide riboside, NR. The salvage pathway, this last pathway, is the most efficient and apparently the main route for production of NAD. The salvage pathway, very interestingly, is similar to recycling. It creates NAD from the byproducts of NAD degradation. So basically, we need NAD like we need water, and we can't live, we can't reproduce, we can't have babies, and we cannot repair damage to our bodies caused by trauma, disease, toxins, viruses, bacteria, etc., without NAD. So now that I put it out there and you understand how important and vital NAD is, let's see how we can increase NAD in the body. Well, we can do so very naturally in 3 major ways. Number 1, we can increase NAD production through lifestyle changes. Number 2, we can bring NAD from the outside into the body to increase the NAD available for our cells. And number 3, we can increase our natural production of NAD internally by providing the substrate, by taking and introducing into the body the precursors. So a few words about each one of these. Number 1, we can increase NAD production through lifestyle changes. Daily exercise and intermittent fasting. Yes, they increase NAD. Consuming a ketogenic diet. Yes, it increases NAD. Consuming foods that are rich in NAD precursors. Meat, poultry, fish. Sorry, vegetarians, but this is the truth. Healthy fats like avocado, nuts, especially peanuts, seeds, mushrooms, and leafy greens. So if you're a vegetarian, zone in on these types of foods. Spending time in natural or artificial heat can increase NAD levels. Heat sources like hot tubs or saunas cause your heart to pump faster, requiring more energy from your body to keep cool. This triggers the increased production of NAD to supply needed energy. This is why I personally believe I feel so good and refreshed after a hot yoga exercise class. Consuming fermented foods and drinks, sauerkraut and kombucha. Some of them contain NAD. Also, we can avoid NAD depleting activities. Guess what those are? Binge drinking alcohol, sun exposure, and binge eating sugar. They all create inflammation and damage our cells, consuming our NAD pool. So, go back and listen and write them all down if you want to know how you can increase your NAD naturally through lifestyle changes. Now, number 2, we can bring NAD from outside into the body so we can increase the NAD available for our cells. So let's explore this a little bit. So how can we increase the body supply of NAD by taking it? How can we take it orally? Can we inject it? Can we administer it in an IV infusion? We can do all these, but there are quite a few limitations to having NAD supplemented into the body. First, we have to get the NAD into the body, ideally into the blood, and then through the cellular membrane. And here's the truth. NAD typically enters the cells through a process of degradation into smaller precursor molecules, which are then taken up by specific transporters. And when these are inside the cells, then they're converted back to NAD within the cell. So interestingly enough, instead of directly entering the cell, the NAD is actually broken down outside the cell, and its components are then used to build NAD inside. So you could say, well, what the heck? Why are we doing NAD then? Why don't we just do the precursors? I'll answer that question. Keep listening. So can we introduce NAD into the body orally, by mouth? Yes, NAD can be absorbed orally, but its absorption is very, very limited, especially compared to intravenous delivery. Oral NAD supplements are available. There's pills, capsules, liquids. It's a very convenient option for boosting NAD levels. However, the body's digestive system and liver will reduce drastically the bioavailability of orally administered NAD. So let me rephrase this in a way that's going to hit home and make it more clear for you. You will end up with very expensive poop. Orally administered NAD faces several challenges. Number 1, molecular stability. NAD is a delicate molecule with a complex structure. Its stability is compromised when exposed to stomach acid and to the digestive enzymes. So likely most of what is ingested will literally not make it into your bloodstream. Number 2, challenge is poor absorption. Even if some undamaged DNA survives in the stomach environment, your intestinal lining gets normally very tight if it's healthy. You have very tight junctions that keep it tight. The NAD molecule is a very large molecule. This means the body will have to break down the molecule of NAD to its precursors, absorb those precursors instead of the actual molecule, and then reconstitute it from its precursors. Likely a very tiny fraction may enter the bloodstream after oral ingestion. And number 3, there's speedy degradation. Studies have shown that when NAD is given orally, it is often quickly dephosphorylated. It's losing its phosphate group and is broken down by the intestinal cells before it can even reach our blood flow and our systemic circulation. Most likely, those cells are hungry for NAD, and your NAD is probably going to stay in the gut. Would it benefit your gut lining? Maybe. We don't know. We really haven't looked at it that way. Due to these challenges, oral NAD might not significantly elevate NAD levels in the bloodstream or within the target tissue unless it's your gut lining. This calls into question the overall effectiveness of a pure NAD in a pill form. So most products out there that sell NAD actually sell precursors for NAD. And I'll talk about NAD precursors next. But let me continue to how best we can introduce NAD into the body. So oral, not ideal. Well, what about injectable NAD? Yes, we can inject NAD into our bodies in 3 ways: intramuscular, subcutaneous, directly intravenously. Let me talk a little about the difference for each one of them, as well as the possible pros and cons. Let me start with IV versus intramuscular or sub-Q. Why IV is the best? Number 1, because you can administer large dosing that is likely to be more meaningfully available to your cells immediately and create a more powerful effect. Smaller doses can be injected intramuscular, and even smaller doses can be injected subcutaneously, as they are more superficial, less likely to cause a reaction. They hurt less, and the NAD is absorbed more slowly. So the intramuscular shots allow NAD to absorb quicker than the subcutaneous shots, not as quickly as the IV infusion, which allows for immediate prompt delivery. The intramuscular shots can allow a little bit more of a bigger dosing than the subcutaneous shots, but not as big as the IV. And the intramuscular shots can create a little bit more of a reaction than the subcutaneous shots do, okay? Receiving a strong dose, IV, let's talk about that for a second, can have some significant downsides and bothersome side effects. Everybody has heard that NAD could be tough on the body. There could be fatigue and a sensation of weakness, and it could be significant and last a couple of days, to follow by coming back to normal and recovering with likely a lift in your energy level that could last from a few days to about 1 to 2 weeks, depending on the degree of mitochondrial depletion. Headaches are a side effect. They can be mild to more severe. They do improve with time and resolve quickly after treatment is stopped and the body processes the NAD. There's nausea and even vomiting. They're significant. And most of the times, they are the limiting factor for the IV drip. This can be mitigated with the anti-nausea medication like Zofran, can also be decreased significantly if the drip is low and the client is adjusted to the dose that is administered. Some people need to start at a low dose, 125 milligrams, then go up to 250, and then eventually go up to 500, as the infusion is tolerated. Minor flushing can be experienced. It's not unusual for some people to experience a sense of anxiety and a sensation of warmth. Also, liver enzymes and bilirubin elevation can be noted temporarily. So monitoring people with liver conditions closely and looking at their labs, it's also essential. There are some newer forms of transdermal delivery systems like patches, nasal sprays, which might be of some proven benefit because it allows for daily NAD availability, whereas the IV infusions, though superior due to immediate delivery and straight to the target point, our cells, are expensive. They take time from your day. It could take anywhere from 2 to 4 hours for an IV infusion, right? I'm going to make an analogy to why IV NAD, though, is superior to all the other forms, so you can easily understand. Now, if you're a woman listening to this podcast, you're probably using some form of daily skincare. That is the equivalent to your daily NAD precursor. If you're a woman, you might have a facial once in a while. That is the injectable NAD. And if you're a woman listening to this, you might have gotten a laser procedure to improve your skin appearance. The IV NAD is like a laser treatment for your mitochondria. You don't do it daily, you don't need it daily, but you need it to lift your mitochondria to a higher state of functioning quickly and efficiently, and nothing gives you that like IV NAD. Let me use the analogy of a guy. If you're a man, you hopefully go to the gym and you exercise daily. Hopefully, that would keep you healthy. Could also help you make some NAD. That could be what the daily NAD supplement will be doing for your mitochondria. If you're a man, maybe sometimes you enroll in a boot camp program. You start a new diet for a few months. Maybe you do both with a specific purpose of acquiring some major positive changes in your metabolism, your health, your weight, etc. That is what your NAD at home injectable might do. You're not going to do that all the time for years on end. You're doing it to achieve a goal or a purpose. Compliance is not great with bootcamp programs forever. You do a program, you're done with it, you just continue with your exercise. And it will not be with at-home injectables either. You do it for 3 months, 6 months, and then you're done, right? If you're a man, you might have had some muscle-enhancing technology to boost your muscle strength, to melt the fat around it, to make you look better, to give it that sculpted look. M-Sculpt Neo costs you a lot of money. But you lay down on a table while the tech worked your abs, your thigh muscles to strengthen them and sculpt your body with zero effort and no risk of injury. No bootcamp risks, right? But with the downside of expense. You had to pay for that laser, that technology. And that is the analogy with IV NAD. It is expensive and you have to take the time to do it, but it's the equivalent of the laser for your muscles. It's like a laser for your mitochondria, right? Everything we bring into our body to enhance and support our natural cellular processes is ultimately subject to bioavailability. If you wonder what bioavailability is the proportional quantity of a drug or substance like a vitamin or a supplement or a hormone, which enters the circulation when introduced into the body and so is able to have an active effect. Doesn't matter what you put on your skin. It doesn't matter what you inhale. It doesn't matter what you spray in your nose. It doesn't matter what drops you put in your mouth if they are not entering the circulation in a significant amount in order to have the desired effect. Only intravenously administered substances delivered directly into the systemic circulation yield a bioavailability of 100%. So if you're considering at-home injectable, intramuscular, or subcutaneous NAD, hey, it needs to be refrigerated after it's reconstituted from a powder. So unless you are a nurse or have experience understanding dosing, it will be really hard to dose by yourself. You have to start with a low dose, go gradually up higher as tolerated, so it should be done under the supervision of a physician or a qualified medical professional. Likely best NAD is the IV infusion because it has 100% bioavailability, and we can guarantee it will increase circulatory levels of NAD to where it will have a meaningful impact on your cellular function. Therefore, you can expect the most drastic and clear-cut improvements in energy, in mental clarity, in mood, as well as overall improvement in neurological conditions like Parkinson's. So the third part, how can we increase our natural production of NAD? We can do so from precursors. What about precursors? And this is the last part of the episode. I promise I'm approaching the end. What about precursors? Well, I told you earlier that NAD is a large molecule. It's subject to challenges when in oral form, as well as the need to likely be broken down into precursors and then travel into the cell where it will be reassembled. The most notorious and well-known and most effective is NMN, nicotinamide mononucleotide. So why precursors? Well, because NAD precursor supplementation represents a potential therapeutic strategy to slow aging and improve conditions of age-related diseases and many other conditions which I have actually mentioned at the beginning of the podcast. Oral supplementation with NAD has not really been demonstrated to show benefits in actually increasing NAD levels in the body. However, oral supplementation with precursors such as NMN or NR, nicotinamide riboside, is shown to provide these benefits. Research shows that NMN is easily absorbed and quickly converted into NAD, actually increasing NAD levels effectively. So why don't we all take NMN daily? Well, there are issues with the supply chain and the manufacturing. NMN is a complex molecule that requires specialized chemistry and equipment for synthesis. Not everyone can make it because achieving high purity, 99% pharmaceutical grade, is crucial for effectiveness and safety, which guess what? Will increase production costs. The market for NMN is inundated with products that are highly different. Food grade, pharmaceutical grade NMN, the food grade often being significantly less pure and potentially containing contaminants, which will lead to significant price differences. NMN is a relatively new molecule in the supplement space, and the technology and production infrastructure of NMN are still evolving and impacting costs. The risk you run when you choose a random NMN supplement, or any supplement for that matter, is the unknown. Some manufactured NMN comes from overseas suppliers with no GMP credentials and could very well be a chemical grade form, masquerading as food or pharmaceutical grade for human use. And here's a startling fact. Even if NMN shows 99% purity, if it comes from a non-GMP facility used for chemical manufacturing, the potential for impurities pose a huge risk for human consumption. In general, transparency about how companies manufacture NMN supplements tends to be seriously lacking. Information about base materials and manufacturing processes simply isn't made public, and too many people don't even bother asking. Another thing you should know is that NMN almost got banned by the FDA in the US because, Listen to this. Metro International Biotech, a pharmaceutical company, is investigating NMN as a potential drug, specifically researching a proprietary form of NMN called MIB626. The FDA has acknowledged Metro's investigations and determined that NMN cannot be marketed as a dietary supplement because it's got the status of a drug candidate. The FDA claimed that NMN was under investigation as a pharmaceutical drug, disqualifying it as a dietary ingredient under its regulatory guidelines. NMN is considered a powerful molecule for promoting longevity, but using one supplement alone, like a magic pill, and literally putting all your aging eggs in one basket, the NMN basket, alone to treat and postpone or slow aging is not the optimal approach. The aging process is multifaceted and involves many mechanisms that must be considered. I've had many clients ask me about supplements. What are the best supplements? How can we slow down aging? How can we feel better? So a combination of NAD products and other longevity supplements is considered a better approach. At Hera Beauty and Wellness and Hera Healthcare, we believe that optimal health and longevity, true anti-aging, is about more than just one magic supplement. We believe that it's about eating the right foods for you, constantly moving and exercising the right way for you, sleeping the right amount, breathing healthy air, and thinking healthy. So in conclusion, as an end, targeting NAD, its precursors, and NAD metabolism has emerged as a potential therapeutic approach to treat aging and aging-related disease and extend the human lifespan. Be aware that much remains to be researched about how exactly NAD influences our health and our aging, and how to effectively restore NAD levels during disease and aging, and whether restoring levels to supraphysiologic levels would be safe for long-term or not. There are many questions that need answers. So how long can you do NAD? Can you do NAD periodically? We don't know. And there are many questions that need to be answered. However, there are protocols, and you need to look and know more about something before you decide to do a treatment. And we do believe about doing a comprehensive evaluation and only recommend IV NAD to our clients that have had a thorough evaluation, and we know what we're doing it for and what results we're looking for. So with this, I hope I rocked your world and I wowed you with NAD information and facts, and it will make it a lot easier for you to decide what will be the best treatment for you and choose the right place to have your NAD. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.